In this lecture, we will be discussing Chapter 6, Mechanisms of Disease, which can be found in the Human Body in Health and Disease textbook. Now, scientists indicate that there are approximately 1 quindecillion microorganisms on the planet. A quindecillion, what is that? Well, I had to look it up. It's a 1 followed by 48 zeros. That's a lot of microorganisms that can be found on the planet. Thankfully, there's only a small handful of microorganisms that are pathogenic or harmful to humans, about 1,400. Interestingly, these microorganisms that are pathogenic to humans thrive within the human body and the environment that is approximately the same temperature as the human body as well. So we're going to be talking about the mechanisms of disease. If you've had a chance to peruse the chapter at all, you will find that there's quite a few topics that we're going to be talking about. First and foremost, we'll talk about the progression, patterns, tracking, and stopping of disease, all of which are important to our role as a surg tech. We'll also talk about the mechanisms of disease and what risk factors are associated with diseases. We'll also cover pathogenic organisms and particles, and yes, the coronavirus will make the list. Lastly, we'll finish up by talking about prevention, control, and treatment methods and mechanisms, and lastly, tumors and cancer. Now, when we talk about the mechanisms of disease, this is extremely pertinent to the surgical technologist because our main job is to maintain sterility. So having an understanding of disease mechanisms is going to help us help our patient to make sure that we're protecting the sterile environment from introducing any type of microorganisms, therefore preventing surgical site infections and the like. So what is the difference between an acute and a chronic disease? Well, an acute disease appears suddenly and persists for a short time and then disappears. That could be the common cold or the flu. A chronic disease develops over a long period of time and lasts for a long period of time, perhaps a lifetime. A good example could be diabetes. One of the words that you may hear frequently is etiology. The etiology is the cause of some sort of disease. So an example of the etiology of high blood pressure might be smoking, diet, lack of exercise, or stress. Sometimes there is an unknown etiology. Now let's familiarize ourselves with some terminology. The first one being health. Health is the physical, mental, and social well-being of an individual, not merely the absence of a disease. So remember, we're taking into consideration mental and social wellness as well. Disease is an abnormality in the body function that threatens health. And like I said, etiology is the study of the factors that cause a disease. The word idiopathic refers to a disease with an unknown cause, and it comes from a combination of two Greek words, idios and pathos. Idios meaning one's own and pathos meaning suffering. So let's think about a time when you went to the doctor, maybe you had the flu. So you went to the doctor, you told him you had the flu, and the next question is, tell me about your signs and symptoms. It's important to remember that a sign is something that's objective and can be measured. For example, if you told the doctor you had a temperature, they could measure what that temperature was and get a number. They could quantify it. However, symptoms are less quantifiable and have a tendency to be more objective. If you told the doctor, for instance, you had a headache, or you had a stomach ache, or you had nausea, all of these are symptoms and they're very subjective to the person that's experiencing those symptoms. Another term that's important to understand is pathogenesis. Pathogenesis is basically the cycle of a disease, the pattern of a disease's development. When we talk about a syndrome is a collection of all the signs and symptoms associated with a disease or a condition, like diabetes, for example. Some signs and symptoms of diabetes could be excessive thirst or hunger, frequent urination, weight loss or weight gain, and fatigue. The patient could also experience blurred vision and nausea. Remember, the signs associated with diabetes would be those that are easily quantifiable. They can be measured. Those that are not as easily measured and are considered more subjective are referred to as symptoms. So epidemiology is the study of the occurrence, distribution, and transmission of diseases in humans. Epidemiologists are physicians or scientists, and they study the patterns of disease occurrence. There are 3 different types of occurrences associated with patterns of disease, which are endemic, epidemic, and pandemic. Remember, endemics are secluded to a local region typically, and a good example of that would be malaria. Malaria occurs in very localized areas of Africa. And endemics can also occur in specific populations according to class and location. Tay-Sachs disease would be another example of that. Now, epidemics occur when a disease affects many people at a time, and we say that this is significant to a geographic location. An example could be flu season in the United States. Ebola and HIV could also be considered examples of an epidemic. The third type of occurrence of patterns of diseases, like I mentioned, is a pandemic. Pandemics are typically widespread and perhaps global or around the entire world. Some examples of pandemics that have occurred in the past include swine flu, cholera, bubonic plague, and smallpox. The discovering and cause of a disease is sometimes difficult because there can be many factors that affect disease transmission. Thankfully, as we understand the patterns and occurrence of the disease, we can come up with preventative measures and treatments. Now, right now, we are battling this coronavirus, and it is also another example of a pandemic. And as scientists learn more about it, they're able to give the general public instruction on how to break that chain of infection and what we can do to protect ourselves and stop the spread of disease. So the way that we stop the spread of disease is by breaking the chain of infection. So let's talk about how we do that. First of all, let's identify what we're talking about. And we're talking about germs. And germs can include any type of microorganism or infectious particle, such as bacteria, viruses, and parasites. So where do these guys live? Well, these guys live in something called reservoirs. And these reservoirs could include people, animals, pets, wild animals like bats, food, soil, and water. Okay, so they live in an environment that's conducive to their survival. And now how do they get out? The way that they get out is they have to have a portal of exit. Now, if we're talking about a portal of exit for a human, that could be through the mouth, through droplet contamination, such as coughing, or through the nose, such as sneezing. It could also include vomit. It can also get out through cuts in the skin. So germs can live in the blood, and if there is a cut, then they can exit the body that way. Other ways that germs can get out is during diapering and toileting, touching contaminated objects, and then touching something else. So how do they get around? That's a good segue. They have to have some mode of transmission. Modes of transmission can include contact with something that is already contaminated, like hand to hand, or hand to eye, toys, those types of things, and droplets. So when you speak, sneeze, or cough, that's how they're going to get around. How do they get in? They can't get in if they don't have a portal of entry. So if you've been listening to the news and following everything about the coronavirus, they highly suggest that you don't touch your eyes, nose, or your mouth with your hands. And this is because this particular virus loves warm, moist environments, and that's where they thrive. And so if you're touching anywhere that has mucous membranes, then you're increasing the chance of infection. And then lastly, they have to have a susceptible host. So remember how I said most microorganisms that are pathogenic to humans are those that prefer an environment that's similar to the human body. So they have to have a way to get in order to get you sick, and then they have to have a susceptible host. Now, hosts that are the most susceptible are those that have a compromised immune system. Now, babies and children have naturally compromised immune systems because they're not fully developed yet. And on the other end of the spectrum, elderly individuals have weakened immune systems because their ability to maintain homeostasis is declining. We also have those that have had organ transplants. We talked about how they are immunosuppressed so that their bodies do not attack their new organs. This makes a susceptible host as well. In addition to that, unimmunized people can also be a susceptible host. And sometimes, even if you're in the perfect health, anyone can become susceptible to a disease. So if we can stop or break the chain at any of those segments that I talked about, then we're going to break the chain of infection. So pathophysiology seeks to explain functional changes that are occurring with an individual due to a specific disease. And there's several mechanisms, and we're going to briefly touch on each one. And the first one is genetic mechanisms. So genetic mechanisms have to do with some sort of alteration in genes. All right, and a good example of that we've kind of already touched on before is cystic fibrosis. Well, the cause of cystic fibrosis is a recessive gene in chromosome 7 that isn't coded correctly for a specific protein. And as we talked about before, this interrupts that normal process of regulating sodium and chloride. So more chloride leaves the cell, which means more salt leaves the cell, which means more water leaves the cell, which results in this thick mucus-like substance in the respiratory system that inhibits breathing. Another example, probably that you're most familiar with, is infectious mechanisms. And this has to do with those pathogenic organisms that we've already talked about before. Coronavirus is a good example of that. Neoplastic mechanisms relate to different types of tumors and cancers. This is abnormal tissue growth And a good example could be melanoma, which is skin cancer. Traumatic mechanisms are any type of physical or chemical agent that causes the body to have a difficult time maintaining homeostasis. And any of those things can be related to extreme heat or extreme cold, mechanical injury, radiation. Some examples of traumatic injury might be a fracture or a laceration. Two more mechanisms of disease are metabolic mechanisms and inflammatory mechanisms. Metabolic mechanisms have to do with endocrine imbalances, and an example of this could be hyperthyroidism or hypothyroidism, and also situations that are associated with malnutrition. A couple examples might be a lack of vitamin C or vitamin C deficiency could cause something called scurvy, and this is usually related to not eating enough fresh fruits and vegetables. And then another example could be a vitamin D deficiency, which is most often manifested in children and can present itself as muscle pain or joint pain or deformity of the joints and the bones. The inflammatory mechanism is a natural mechanism that happens in the body, and it's a set of reactions that are initiated by the immune system and typically include things like pain, heat, swelling, those kinds of things. There are three types aside from the regular inflammatory response, which is one type. There's also autoimmunity and degeneration. So autoimmunity has to do with an overreactive immune system. This is where the body develops a reaction to itself, hence that first part of the term autoimmunity or self-immunity, right? So the body is fighting against itself. And some examples of autoimmune diseases are rheumatoid, asthma, lupus, and allergies. Lastly, degeneration. Degeneration has to do with different types or different body systems or components of those systems wasting away or deteriorating. Some examples could be muscular dystrophy, multiple sclerosis, Parkinson's, and grouped in there are also other degenerations associated with the normal aging process. So how can we avoid certain disease risk factors? Well, one way is by paying close attention to our lifestyle choices, such as our diet, our exercise, how we manage stress, and if and when we seek medical attention. We see these types of risk factors are more increased in certain populations, whether it's due to socioeconomic factors, or it's due to isolation factors, or it's due to a lack of knowledge and education. So some risk factors we're going to cover are listed here, and the first one is genetic risk factors. So you could be predisposed to a condition if it's maybe passed on by your mom or your dad. So there's a genetic risk factor there. Age is also a factor. It can factor in when you're really young and your body's ability to protect itself is still developing, or it could be on the other side of that, where we've had this extended exposure to our environment, and because of that, our tissues have been exposed to heat and radiation and those different types of things. And, you know, some environments are more harmful than others to work in for sure. Lifestyle, like I said, is a big one. It's really the major one that we can control, right? Because we can't control how the chromosomes shake themselves up and disperse themselves. And, you know, if we live long enough, we're going to have some sort of breakdown in our tissues and our organ systems. So lifestyle is really the only thing that we can control. And we want to try to limit those risk factors that are associated with lifestyle. Stress is another one. So self-care, coping mechanisms, because stress can disrupt every system in the body. And I think we all know that. Environment, again, what we expose ourselves to, whether it's levels of radiation, pollution, contaminated drinking supplies, climate, cleanliness, or lack thereof. And then pre-existing conditions. Some individuals are predisposed to certain types of conditions which increase the risk of secondary conditions. So if there is diabetes, for example, prolonged disease leads to a reduction in blood supply to the extremities. It also leads to neurodegeneration, which also increases the chance of infection if you're not getting good blood flow there. And also if you can't feel anything, you might not know if you've, you know, got something in your foot or those kinds of things. So that could be an example of pre-existing conditions. So now we're going to move on and talk about some pathogenic organisms. Remember, pathogenic organisms are organisms that cause disease. Okay, so the first one we're going to talk about is virus, right? And a virus is a microscopic, non-living thing, all right? And it's considered a nucleic acid core with a protein coat. And basically what a virus does is invade its host cells and hijack its machinery. So viruses are like the pirates of the microorganism world. They're going to invade the host cells, they're going to take over those cells' machinery, and they're going to use that machinery to do their dirty work. They are classified by their shape, by their type of nucleic acid, and the methods by which they reproduce. Some examples of viruses include the human immunodeficiency virus, the coronavirus, and various other types of viruses like flaviviruses. Oftentimes in the operating room, there will be a time where there is some sort of fluid or tissue that looks like it might be infected, and the surgeon will want to culture that. When we do that, that's called a culture insensitivity. So they're going to take a culture of that fluid or tissue, and they're going to send it to the lab, and the lab is going to test it to see what types of antibiotics it's sensitive to, hence culture and sensitivity. So you can see here, they've grown some bacteria or some sort of microorganism on this in this petri dish, and they have placed these little discs that are impregnated with different types of antibiotics to see which ones the microorganism is most sensitive to, and that will be able to guide the healthcare providers to give the patient an antibiotic that's going to be most effective on the microorganism. Okay, so let's talk about prions now. Prions are pathogenic proteinaceous molecules that lack genetic material. Now, if you've heard of mad cow's disease, a similar situation, a similar disease is caused in humans called Creutzfeldt-Jakob's disease or CJD. And with CJD, it could take years for the patient to manifest symptoms that are similar to Alzheimer's disease. This disease is very rare. It did originate in Europe, and there are very, very few cases of it in the US. However, if we do know that somebody is infected with prions and we're going to operate on them, we have to take special precautions, which means we're going to use predominantly disposable things, and everything will have to be discarded at the end of the surgery because the sterilization methods that we have cannot kill prions. So we want to make sure everything that we use is disposed of. There are some experimental sterilization methods at this point, but nothing that we're using as a standard of care. So remember that I said there's a quindecillion microorganisms on the planet Earth. Well, about 5 million trillion of those, which is a 5 with 30 zeros. Remember, a quindecillion is 1 with 48 zeros. So 5 million trillion bacteria live on the Earth. Fewer than 100 of those cause diseases in humans, so that's a good thing. Now, bacteria can be classified in several ways. It's important that we know that they are very tiny cells and they have no nuclei. They just they have a little strand of RNA that's kind of swirled inside of them, but no nucleus, all right? And their job is to secrete toxins, parasitize host cells, or form colonies. Okay, so let's talk about some ways that they can be classified. One of the ways that they can be classified is regarding whether they are aerobic or anaerobic. Aerobic bacteria require oxygen to live, whereas anaerobic bacteria do not require oxygen to live. And typically, we also talk about the staining properties of bacteria through something called a Gram stain. Now, if we're staining a bacteria with this kind of purpley blue dye that they use, and it is a purple color, we say that that is Gram positive. However, if it's more of a pinkish color, then we classify it as Gram negative. It's important to be able to classify these bacteria so that we know how to stop them in their tracks. On this slide, you can see what I was just talking about Gram negative versus a Gram positive staining of bacteria. The ones on the left are kind of a dark purpley blue. Those are Gram positive, and the ones on the other side come up as like a bright pink, which are Gram negative bacteria. All right, now this depends on the composition of the wall and whether they stain a dark purpley blue or whether they stain pink. So another way we classify bacteria is by their shapes. So there are different types. You've probably heard of some of the names like Staphylococcus. Well, the reason that it has that name is because of its shape. Staphylococcus is round, plural is cocci, so staphylococci would be more than one, and cocci refers to it being a round shaped. Now, staph refers to it being in a cluster. All right, so if we find round bacteria that kind of cluster together like grapes, we're going to call that Staphylococcus or Staphylococci. If we see bacteria that are round but pair together, that would be a Diplococci. Other situations where you see bacteria arranging themselves is a good example is Streptococci. So I think of strep as a strip and staph as a group, like a staff meeting. That's how it helps me to tell those two apart. So Streptococcus is going to be like a chain or a strip of round bacteria. Other sizes shapes that we also have are bacilli, which is a rod-shaped, and spirilla, which is kind of a little spiral rod shape. All right, and again, they're spirilla mostly are kind of by themselves, but we do have chains of bacilli. We would refer to that as streptobacilli. All right, and then just a little shout out to spores. Spores are these little protective coats that some bacteria can form when there's unfavorable conditions so that they can protect themselves until situations get better. This also poses a challenge for us when we're sterilizing instruments because spores resist extreme conditions. So they're more difficult to kill. We have briefly spoke about the significance of spores and their role, and here you can see a picture of this biological indicator. There are different types of spores that we use for different types of sterilization methods. This one here, Geobacillus derothermophilus, is used for steam sterilization. Geobacillus derothermophilus forms a spore. They're also thermophilic, which means they love the heat, which means not only are they more difficult to kill because they form a spore, they're more difficult to kill because they love heat. So this is another measure that we can use that shows, gives us reasonable proof that something has been sterilized and everything has been killed. So we can use this live spore in the sterilization process. We incubate it afterwards, and if nothing grows, then we know that there's a pretty good chance that everything's been killed and there are no microorganisms present on the instrumentation. So scientists expect that there's probably about 5 million different fungi living on our planet, and taxonomists have already classified, categorized, and described about 120,000 of those. Good news, similar to bacteria, there is only about 300 of those fungi that are actually pathogenic to humans. A couple examples that you may have heard of diseases that fungi cause. One is thrush, which is caused by a candida organism, and another one is athlete's foot, which is caused by a microsporum organism. Now, fungi are very simple organisms, and they are similar to plants, but plants have chlorophyll and fungi do not. Yeasts are also classified as fungi. They're small single-celled organisms. And then we have larger multi-celled organisms that are referred to as mold. Various types of fungal infections are pretty difficult to treat. We call these mycotic infections. And although there are some antifungals that get prescribed, these little guys are pretty prolific and we have a difficult time getting rid of them. So protozoa are large one-celled organisms that have DNA that's organized in a nucleus. Often we refer to them as protists, and these little guys like swimming around in fluids. So we'll pretty much find them in different types of fluids. Water is a common one. And then how these little guys work is they actually parasitize other cells and destroy them. Protozoa are grouped by the types of projections that they have extending from themselves. So 3 different types: amoebas, flagellates, and ciliates. So amoebas have these little projections called pseudopods or pseudopodia, and they're like these little false feet that help them move around, right? They live in water, so they need to have some way to get around or swim around, if you will. And so amoebas have these little false feet, or what we call pseudopods. Now, flagellates, we already talked about what flagella are. Flagella are these long whip-like tails, and some of them have 1, some have 2, some have 3, some have 4. We'll talk more about this in microbiology, but flagellates, to simplify things, possess flagella. Ciliates, remember cilia are those little hair-like projections, and so that is another classification of protozoa or grouping of protozoa. Now, sporozoa, they do something interesting. They enter the cells during the first phase of a two-part life cycle. So the first phase is to enter a cell, and then the second phase is that they are born by vectors. So vectors are could be classified as any type of organism that transfers another organism, like a fly or a mosquito or a tick, for example. So two different ways that sporozoa can get transmitted. Either they enter a cell or they are transferred by a vector to the host. Here you're looking at the amoeba Naegleria fowleri. This specific pathogenic protozoa can be found in lakes and streams and springs and freshwater ponds, but it can also be found in public pools and hot tubs that don't have enough chlorine. So although infections in humans are very rare, probably about 30 infections in the last 10 years, let's say. What this protozoa causes is a very rare type of brain infection. And the way that a human could get it is if you are swimming in one of these areas that are populated with this amoeba, it would enter through the nose. And once it enters through the nose, it's a pretty short pathway right to the brain. So it invades the brain through this thin little bone that separates the nasal cavity from the brain called the ethmoid bone. And it can also cause fatal central nervous system infections. Pathogenic animals are large, complex, multicellular organisms. So remember, protozoa were singular-celled organisms. Pathogenic animals are large, complex, multicellular organisms. If you've ever heard of somebody having a tapeworm, this is what they were talking about. So the pathogenic animal, what it does is it parasitizes or damages human tissues or organs. So remember, a parasite is something that invades the host and damages the host for the benefit of its own survival. And some examples are nematodes, platyhelminths, and arthropods. So nematodes, what these do, also referred to as roundworms, cause GI and bronchial complications and can cause obstructions if they get too big, and they're the largest type. Now, platyhelminths, they infest a variety of human organs, like the liver, and they can also be found in pork and beef. So when we talk about needing to cook meat well, so this is one of the reasons why, and pork is a big one with the platyhelminth. And then lastly, arthropods. Arthropods are those little vectors that I was giving examples of. So whether it's a mosquito that could be carrying malaria, or a tick that could be carrying Lyme disease, it could be mites or spiders or scorpions, or any type of little critter that can transfer one of these microorganisms to another host. So now let's talk about prevention and control. So there's a couple mechanisms that we're going to talk about, and as far as mechanisms of transmission, and the first one is person-to-person contact. So person-to-person contact, this is one person touching another person. That's why right now with this coronavirus pandemic, we're practicing social distancing. So this can be prevented through education. Once we know that a microorganism can be transmitted person to person, then we can eliminate those person-to-person contacts. And it can also be prevented by using something called aseptic technique. And we use aseptic technique in surgery. It's the rules that we live by and play by. But in normal everyday life, it could be as easy as washing hands or using some sort of hand sanitizer. Another mechanism of transmission is environmental contact. So if somebody is infected with the microorganism, they can touch a surface. Microorganisms vary in how long they can live on a surface, but if it is viable on that surface and somebody touches it and ingests it or rubs their eyes or something like that, then they can be infected with that microorganism. And one of the ways that we prevent this is by avoiding contact or cleaning surfaces regularly. If you're not cleaning your phone regularly right now, you should be cleaning things that you touch frequently. And then safe sanitation practices, of course, disinfecting and sanitizing surfaces. When we talk about mechanisms of transmission, we also have to talk about opportunistic invasion. And this basically means that certain microorganisms aren't harmful to us unless they're given the opportunity to be harmful to us. And an example of this is Staphylococcus aureus or Staph aureus. Staph aureus is an opportunistic bacteria that lives on our skin, and typically it doesn't do us any harm. However, if we get a cut or a scrape or a burn or something like that that damages the integrity of our skin, then these little guys will take the opportunity to infect that wound or get into that wound. This is why it's really important in surgery that we perform a skin prep where we cleanse the surface of the skin or the area that we're going to be doing surgery. We cleanse that really well in hopes that we're going to reduce the number of these Staph aureus bacteria. All right, so it can be prevented by avoiding changes in skin and mucous membranes, like I mentioned, and the cleansing of wounds. And then the other one that we touched on already is transmission by a vector. And in this bottom picture, you can see some examples of these little vectors like mosquitoes and ticks and flies. But these little guys can bite one person, and if they have some sort of microorganism that's in their blood or on their skin, they can pick it up, and then when they land on another person, they can deposit it there. And some ways that we can reduce vector transmission, of course, education is always a factor, but also reducing the population of those vectors, reducing contact with those vectors, and the use of pesticides is also helpful. So prevention and treatment strategies. One very effective preventative measure is vaccination. So immunizations, vaccinations, they stimulate immunity by giving the individual a tiny little bit of whatever that microorganism is, whether it's varicella for chickenpox, or measles or mumps or rubella, whatever the case is. This triggers the individual's immune system, and the individual develops antibodies, and these antibodies form something called memory cells, and these memory cells just kind of lay dormant, and if at some time the individual is exposed to that type of microorganism again, the antibodies jump to attention, and they fight off that microorganism for us. Another way to prevent or treat is, of course, with drug therapy. And drugs are going to facilitate the destruction or the inhibition of those pathogens. Antibiotics and antiviral drugs are two common types of drug therapies that we use to treat microorganisms. Antibiotics can either be derived from natural compounds, from living organisms, or we are able to manufacture some synthetically now. And then antiviral drugs, they inhibit the viral reproduction and slow down progression of viral infections. But antiviral drugs are tricky because, as I mentioned, viruses gain entrance to the host cells and they hijack their machinery. So when we're killing a virus, we're killing our own cells, and that's why it's really difficult to find medications that work to treat viruses. So in a previous lecture, we talked about something called apoptosis, which is cell suicide. It's programmed cell death, right? So a cell knows that it's not normal, and so it gets destroyed, or there's processes in the body that destroy those damaged cells. Sometimes that mechanism does not work properly, and abnormal cells start to reproduce themselves and multiply. And this is when we get these neoplasms, or abnormal growths of cells. We talked about two different types. The first type being benign tumors, which typically remain localized, and we refer to them as non-cancerous. And the other type being malignant tumors, which do oftentimes spread and can form secondary tumors, which we refer to as cancerous. The way that these malignant tumors spread is through something called metastasis. So with metastasis, and these cells are so tricky, and we could spend an hour just talking about how metastasis works, but these abnormal cells have this uncanny ability to adapt to their environment and will literally crawl their way out through a vessel into the interstitial fluids, and they will hide against the vessel wall until they know that it's safe. Now, they only have a few days to do this, maybe 3 or 4 days, until they hop in or until they can mutate a little bit more to survive within this new environment, and they make their way into the lymphatic system. And this is how they travel around. Now, scientists have discovered that certain types of cells have a affinity for certain types of environments. So they will more likely deposit themselves in one area as opposed to another. So remember, metastases are cells that, the process is cells break off from the original tumor and they make their way into the lymphatic system, and they travel to a different part of the body and they implant themselves there. So let's break down the different types of benign and malignant tumor types. First, we're going to talk about benign tumors, and we are going to talk about two different types. So first, benign epithelial tumors, and then benign connective tissue tumors. Remember, these are what we refer to as non-cancerous tumors. They don't break away and metastasize to other places of the body. They're contained and typically easy to remove. So benign epithelial tumors, these are going to be the tumors that attach themselves or grow from different epithelial tissues in the body. The first type is called a papilloma. Papillomas form finger-like projections, and an example of this would be a wart. Adenoma is a general term for benign tumors that arise from glandular tissues. And then a nevus is a small pigmented tumor, and a good example of this could be a mole or some sort of birthmark even. Now, connective tissue tumors that are benign, we often refer to as lipomas, osteomas, or chondromas, and these are named from the tissues that they arise from. So lipomas are going to arise from fat tissue, where osteomas are going to arise from bone tissue. And then lastly, we talked about cartilage cells. We refer to them as chondrocytes. And so those tumors that arise from cartilaginous tissue are called chondromas. Two other types of tumors that we're going to talk about are carcinomas and sarcomas. Carcinomas are malignant epithelial tumors, again, arising from epithelial tissue. A common one that you might have heard of, especially here in Arizona with all the sun that we have, is melanoma. Melanoma involves melanocytes, and melanocytes are the pigmented cells that live deep within our skin and give our skin its pigmentation or the color that it has. Adenocarcinomas are cancerous tissues that arise from glandular tissues. And then sarcomas are cancerous tumors that arise from connective tissue. So examples would be lymphoma, remember lymphatic, like the lymphatic tissue. Osteosarcoma, osteo is in there, that means bone. Myeloma, which is bone marrow tumor. And then fibrosarcomas, which are cancers of various fibrous tissues. Some examples, remember we talked about fibrous tissues being like the discs that insert themselves in between the vertebrae. There is still a lot that we don't know about causes of cancer. However, what we do know is that cancer involves hyperplasia. Hyperplasia is the growth of too many cells. And anaplasia, remember, which is the development of abnormal, undifferentiated cells. So we have abnormal cells that did not undergo that programmed cell death or apoptosis, and now they're starting to multiply themselves. So we have abnormal cells that begin to multiply, or we have cells in general that their reproductive process, their regeneration is sped up. Okay, so we have these two things happening simultaneously. Some situations, some causal factors of cancer that healthcare professionals have identified are certain genetic factors. There are certain genes that they've identified called cancer genes or oncogenes, okay? There's also different carcinogens that can increase the cause of cancer, increase the chance of mutations in the DNA. Some examples are tobacco, and then in our realm, a sterilant that we used to use quite frequently called ethylene oxide, or ETO, it's not used as much anymore, has been known to cause cancer as well. So there's different types of carcinogens. Age is also a factor. As we get older, our cells, not only do they not typically reproduce as quickly, but they might not be reproducing correctly, and we have those environmental factors going on as well. And lastly, they've identified some types of viruses that are known to change the genetic machinery of their cells, and the human papillomavirus is a good example of that. The most important takeaway, I think, as far as cancer is that early diagnosis is really important as far as success rates, survival rates, and outcomes. Some signs of cancer that the chapter talks about, first and foremost, is the appearance, right? If a sign of cancer could be that you feel a lump, or a color of a mole has changed or is growing, or something of that sort. So appearance is always can be a first sign of cancer. Some methods that they use to detect cancer also include self-examinations. Healthcare providers suggest that women perform breast exams in the shower, as well as men performing testicular exams in the shower on a daily basis. That way, if you notice any changes, you can get to the doctor right away. And a lot of times they say that these changes are discovered often by a partner or a spouse instead of themselves. Some diagnostic imaging procedures that they can use are mammographies or CT scans, MRIs, and ultrasounds. Now, if we expect something is going on, we can biopsy that tissue and test it to see if it is indeed cancerous. There are some routine checks, right, like a pap smear. That it used to be suggested that every single year women have a pap. However, if they've had several good PAPs in a row, then they can go for 3 years before they have another one. Statistics indicate that 10% of breast cancer is diagnosed with breast reduction procedures. This is critical as the surgical tech to know this information, because when we receive the specimens during a breast reduction, we're responsible for separating the tissue into 2 separate specimen containers, whether it's the left breast or the right breast. And because 10% of breast cancers are diagnosed with breast reduction, it is really important that we are getting the correct tissue into the correct specimen container. If tissues were to get mixed up, we might have a false diagnosis with that. And then blood tests are another way of testing for cancer. They can look for different types of elevated enzymes in the blood or ions such as calcium. Okay, and then they can also do something called the PSA test, a protein-specific antigen test, and a lot of times you might hear this associated with the rule out of prostate cancer. These are just some images of different types of scans and their results. So you can see the first one is a mammogram, and you can see the tumor there is very visible. Right here, I'll put a circle around it, the tumor here. And the next one is the CT scan, and you can see the tumor there. Here's what it would look like on an MRI. You can see the tumor there. And then the last one, this is an ultrasound, and you can see the tumor there. So 4 different types of radiographic images, so you can see that they all can diagnose different types of cancerous tumors. Oncologists use techniques such as staging and grading to classify and provide probability outcomes for those individuals that have cancer. So staging is the classification of the tumor, and this is typically indicated by the size of the tumor and the extent of the spread or metastasis of the tumor. Grading is going to refer to the probability outcome, or what is the survival rate, if you will. So different stages, the higher the number, the lower the probability of the outcome. Cachexia is a syndrome that is a lot of times associated with cancer and can represent symptoms such as appetite loss, weight loss, and general overall weakness and malaise. And causes of death by cancer typically include secondary infections, organ failure, hemorrhage, and other undetermined factors. So there are a variety of ways that cancer can be treated depending on the stage and grade of the malignancy. One way that we can treat cancer, of course, is surgically. Other ways we can treat is by giving the patient chemical therapy, which is referred to as chemotherapy. Radiation therapy or radiotherapy is using gamma radiation, concentrated gamma radiation at the site of the tumor. So where chemotherapy is actually injected into the blood, radiation therapy is an external process that's focused on the area where the tumor is. Laser therapy is also something else that they're using to treat cancer. Immunotherapy is something that they give in addition to these other treatments that they're doing, which helps to increase the immune system of the patient. And of course, every day they're coming up with new strategies to treat cancer, different drugs that target specific molecules and whatnot. So what you're looking at here in the top two pictures is an excision of a basal cell carcinoma from this woman's left cheek. And then what you see in the two images below, which looks very drastic, is what we would call a rotation flap. So what essentially they have done is dissected all of this tissue free, and you can see the jugular there. That's pretty crazy, exposed. And then the loosening up of that skin is going to allow them to advance it all the way up to cover that defect. So you can see how she has really nice coverage here after they performed that rotation flap. And this is a common occurrence when we see skin cancers, where we will do these different types of advancement flaps or rotation flaps to cover the defect. This is what she looks like now. Is that not amazing? From that picture that you just saw to this picture here. That's why we have plastic surgeons do these procedures. This looks amazing. The inflammatory response is a series of processes that attempt to reduce injury to tissues. This helps the body to maintain homeostasis. So let's talk about each stage. The first stage is capillary widening. So blood vessels are going to dilate, which is going to increase blood flow to the area. Second, there's going to be an increased permeability in the walls of the capillary, which allows these first responders to squeeze out of the capillary and actually go directly to the site where the injury has occurred. When this happens, water is also going to leave, and this is what causes swelling or edema. So these chemicals are released, and these specific chemicals that are squeezing out in to the interstitial spaces, they attract white blood cells, and this process is called chemotaxis. Now, sometimes there becomes this large buildup or accumulation of white blood cells and various bacterial cells and dead tissue and other debris, and this is in this case, it doesn't happen every time, but this is when you might see some sort of exudate or pus that develops at the injury site. And here is a lovely picture for all of you visual learners if you would like to see what it looks like when we drain pus out of a wound or potentially the abdomen. So here you can see this yellow fluid, that is the pus or exudate, and that's an accumulation of white blood cells, dead tissue, bacterial cells, and other fun types of debris. So inflammation can be acute or chronic. It could also be local or systemic. Remember, acute means it comes on fast and it's short lasting, and chronic means it could take a while to ramp up, but it's going to be there for a long time. An example of acute inflammation could be a fever. And what happens with a fever is the thermostat in our brain resets at a higher temperature, and this is thought that this mechanism kills off pathogens, and some pathophysiologists also believe that higher temperatures enhance the activity of the immune system, and then after the crisis resolves itself, then the fever typically breaks and is eliminated. With chronic inflammation, which is either local or systemic, like I mentioned, always causes damage to the tissues and can lead to other negative situations occurring in the body. Some examples of different types of inflammatory conditions are arthritis, asthma, eczema, and chronic bronchitis, which are among the most common chronic diseases in the world. I hope you have enjoyed the lecture on Chapter 6, Mechanisms of Disease. Make sure you have your muddy points ready to discuss in class. I look forward to speaking with you then.